Outstanding Program, the House of Everyday Learning. The House of Everyday Learning and Beyond Boundaries Therapy Services have partnered to create an innovative program to bring pediatric services to rural communities in North Dakota. Families would often express that the drive to Fargo for their children's appointments was burdensome, especially if the trip had to be made frequently. Time away from work and school, transportation, and costs provide significant barriers to weekly or bi-weekly visits. To combat these barriers, the House of Everyday Learning and Beyond Boundaries Therapy Services decided to bring their services on the road. They teamed up to create the Mobile Therapy Unit.
Hi, I'm Stacy. I'm a physical therapist.
And I'm Bobby. I'm the occupational therapist.
And I am the driver of the MTU.
And I'm the rider. Both Stacy and I grew up in rural communities, so I feel like it's really near and dear to both of our hearts. And we just really understand the importance of having access to services. A lot of the kids we see honestly probably wouldn't ever be able to seek out therapy just because of the distance and time. So it's been really nice to go meet them exactly where they're at.
The bus has provided an awesome opportunity just to find where clients are comfortable and make that a little bit easier on parents when it comes to figuring out what time in the week they're going to be able to get their kids to therapy.
This state-of-the-art mobile sensory/motor gym drives to rural North Dakota communities to provide free developmental screenings to children in the region. The Mobile Therapy Unit also provides physical, occupational, and speech therapy services. Its design allows for a unique sensory motor experience while also providing a quiet space for children's therapy. Specialized programming available includes sensory processing, attention and focus, behaviors, social and peer interactions, and motor coordination and balance. The Mobile Therapy Unit not only decreases barriers to healthcare such as transportation and costs, but allows a direct partnership with parents and communities. These strong relationships help grow awareness of pediatric health services, along with increasing availability and access to health care.
As a parent, if you have to take time off work to go bring your child to appointments, that can be a burden and difficult to do. And so if we are thinking about the families that live in these rural communities that have to drive upwards of an hour just to get to a location that has the services available, that can be a very large burden on the families, on the children, and on time away from work. So one of the biggest benefits that I saw from being part of this team and being part of this project was that we were able to bring that care directly to those communities. And we saw immediately that burden of time away, drive time, transportation, time away from school, those barriers were eliminated.
In 2021, the Mobile Therapy Unit piloted the new program in Milner and Leeds, North Dakota, partnering with daycares, schools, and healthcare providers. Within 5 months of the Mobile Therapy Unit's debut, the program was able to provide free developmental screenings to 122 children. Within 5 months of the Mobile Therapy Unit's debut, the program was able to provide free developmental screenings to 112 children. It also successfully served 10 children on a weekly basis for occupational and physical therapy, eliminating the need for families to commute long distances for appointments. The Mobile Therapy Unit has plans to expand its reach to more North Dakota communities in 2022.
The idea was only the first step, but from there it really takes a village, and this would not be possible without some special recognition. So a huge thanks to my husband for always listening to my ideas to make a difference in this world and supporting through all of the ups and downs. To my parents for raising me in a rural community, which taught me the importance of the bond in a small town. To John Porter for believing in this mission and taking time to introduce me to principals, superintendents, and daycare providers in the South Valley. And to those rural communities that we're serving in, everyone has absolutely welcomed us with open arms, great collaboration, and such sincere kindness. To our donors, Blue Cross Blue Shield Caring Grant, NDAD Gibbons Memorial Grant, the JB Foundation, and the Medica Foundation. To Matt's Automotive for helping us to keep safe on the road as we travel. And I'd like to really thank Brittany Anderson for nominating Beyond Boundaries Therapy and the House of Everyday Learning for this award. And none of this would even be possible without the support and commitment of a phenomenal team of therapists Brittany, Bobby, Stacy, and our marketing guru, Laura, your desire to bring highly skilled therapy intervention to rural communities is absolutely admirable and inspiring. You have truly made this dream of serving children and families in the rural community a reality. You are making a difference today for a brighter tomorrow. We hope to continue this mission of bringing the mobile therapy unit to more communities for many years to come. Thank you very much.